Okay, we're recording.
Hello, everyone. Welcome to this video talk on the impact of COVID-19 pandemic on families and how to maintain psychological and emotional wellness. With me on this talk are Dr. Shakeh Ayvazian, who is a neuropsychologist and a member of the board of the Armenian American Mental Health Association, and Dr. Elizabeth Petrisca, who is also a member of the association. My name is Shakeh Kaftarian. I am a psychologist, and currently I'm the co-president of the Armenian American Mental Health Association. Today, we're going to conduct a simple conversation about what's happening throughout the world. This is a very unique experience that the entire world is exposed to. This has nothing to do with one country, one continent. It has everything to do with everyone. All of the continents, all of the countries are involved. All of us, all members of the family are involved. So today we're going to draw on whatever we know from previous experiences, although they weren't really exactly the same as what we're going through, as best as we can. We will draw from studies that were conducted at NIH, CDC, at the different universities across the world, Substance Abuse and Mental Health Administration, as well as from private practice. So the evidence will be both from studies as well as very practical empirical evidence of what is going on and what we can do. So as I said, this is a worldwide issue. This is a condition, a predicament, a human experience that cuts across different kinds of social structures, different kinds of health systems. We know that our health systems are trying to deal with this. Our entertainment, our nutrition systems have all been impacted by this. The way we shop, the way we cook, the way we eat, the way we exercise or not, the educational system. This is a time that we have to do homeschooling. This is a time that distance learning has become a major issue. So, and the political system, the way news is reported, the way the news is reported in the context of political interest and how it impacts people. So this is a unique time. We're going to talk about several age groups because the experience of a major experience such as this one impacts people based on who they are, their background, their gender perhaps how old they may be, perhaps their position in a family setting, perhaps their financial situation, their social situation. So we're going to talk about all age groups that may be within a family. We are going to talk about children, teenagers, the middle-aged people who have to take care of themselves, as well as their younger ones, or their parents, their aging parents, who may be in other settings, or may have come back from those settings and now are residing with them. So these are really very different times, and with that, I'm going to open this to a conversation. So Liz, let's talk about children. Tell us a little bit about how children are doing in the context of this experience.
Yes, definitely. This is a confusing time for everybody, and everyone has a different reaction of what they're experiencing, and it's very important to be okay with that and feel, like that's a normal thing. For children specifically, a lot of children are feeling very confused. They're feeling disappointed, some of them because they're not being able to go to school. They're feeling anxious, irritable, and a lot of times kids are also acting out on these feelings because they don't know how to deal with them. So they might be feeling really irritable or sad, but instead of course, expressing that, they're actually being aggressive with their siblings, by either hitting them, or they might be yelling more or just feeling more on edge. And so with kids, it's very difficult because, especially depending on the developmental level, it's hard for them to really express what they're feeling. So I know a lot of kids are feeling also disappointed again because they're not being able to do the activities they were scheduled to do, especially if they were supposed to graduate, let's say from high school or from middle school. It's very hard and disappointing for them not being able to do those things.
Liz, I have so much admiration for you because working with children, I think, requires a special amount of patience. I work with seniors and adults primarily, and they tend to kind of tell you what's going on. So I know that with what you're doing, you need to use special techniques, and because they're not always so open about what they're thinking or feeling, and they kind of exhibit things more behaviorally or express themselves behaviorally. So
And this,
that's a challenge.
yeah, this is a very special time, very different time, because all the kids are home. They have to do their academic work at home.
Mm-hmm.
And it's homeschooling for adults who know nothing about homeschooling. Homeschooling is not everybody's cup of tea. And distance learning, the teachers are learning about distance learning. And transitional time for the administrators of schools. How do they manage the academic curriculum in the context of this very tenuous and very rapidly changing system? So what do you know about that? How have you learned about that? Has that come to your attention in your practice?
Shakeh, with what you had said, I'm amazed that this happened even in my own lifetime. I always read about incidences that happened in history books, and I feel like history is being made in my lifetime, and I'm trying to adjust to it and trying to deal with it both personally and professionally. On a personal level, my own mother is in a board and care facility, assisted living, and I'm not able to see her, but I can see her through the window. They don't allow people in for their protection. But I even went yesterday, brought her things. And then on a professional level, I'm working with families who are having seniors coming back into their homes because they don't feel safe having them in an assisted living because of all the infections that are happening. And so they're having to deal with a new set of challenges of not only having their children in the home, which is what Elizabeth is working with, but having their parents back in the home or relatives and dealing with those challenges. So it's kind of interesting.
And also the financial challenges of family, middle-aged people who have to make sure that they have food on the table. Actually, the purchase of food, making sure that you have enough groceries to be able to feed everyone.
Mm-hmm.
I mean, going to the store and then seeing things being sold out, I'm feeling for everybody, even while I'm dealing with the challenges myself.
Mm-hmm.
Right. And then teenagers, for example, this is really a very tender time in one's development. This is a time that they are very socially conscious. Their lives are very much built on their social relationships. The fact that they are beginning to experience romantic relationships. What happens to those? How do they deal with that predicament? Those emotional situations that may be tugging on them. And how do parents deal with this physical distancing issue when it comes to teenagers' continuous quest for being in the company of their peers, in the company of their friends? So what have you heard about that?
I can imagine it's really difficult for parents to watch their children, being so upset that they're not able to interact with their peers socially, especially teens. because they have a lot of social events, especially seniors in high school, you know, missing out on all the different events that they have. So I know if I can empathize with parents, they must be feeling a lot of emotions and a lot of extra stress as well, because just the confusion of not knowing, you know, how to do homeschooling. Even how do you tell your teenage daughter or son, hey, you need to go online and take your classes? You know, it's very hard for them to do that. You know, even having that change of routine, because you know, as it is, it's difficult to be motivated to do online classes from home.
Elizabeth, even I was reading an article in the paper yesterday about how teens are missing out on certain milestones during this time, about graduation, grad night, maybe the prom, and different things that they've been waiting for and expecting all this time, and then now these things are being canceled, and kind of how it's affecting them.
Right.
It's kind of, it was a good article, and I think it was the Wall Street Journal.
So I have a neighbor whose grandson has been going out of the house at night when everybody's in bed to meet up with his girlfriend, and they're having a
Oh my
great
gosh.
difficulty dealing with that. And also the fact that routines are completely gone out, meaning that with this new physical distancing situation, the fact that people don't have to be in a particular physical location at a particular time, that everything has fallen apart. Let's talk about creating the importance of creating new routines that everyone in the family, children, teenagers, adults, and elders have to live up to. So, Dr. Jack, let's hear about seniors and why is it important for the elderly to have a routine?
Well, I think that even though seniors are moving back into people's home, into your home again, and not in the facility maybe where they were living previously, they still need the care that they were receiving before. And a lot of that is medical, dealing with medications, dealing with their pain, dealing with their physical issues. And so whenever I'm working with seniors, I always like to make sure that I understand fully what their medication protocol is. And the fact that they're may not be taking their medications the right way, or the way they were prescribed, or they may be taking more medication than they should be, or taking less medication than they should be, or taking medications that are having a contraindicated effect, or that are working in a negative way with other medications. So I want to make sure that I talk to, as their psychologist, I'm not a medical doctor, but I'm a clinical psychologist. I want to talk to their medical doctors to make sure that everybody's on board and working as a team, and to make sure that the medications are being correctly prescribed and that all the doctors know what the other doctors are doing. That's important. And then I also want to have a good idea of what their pain issues are, because they may be having pain, but if they have dementia or memory problems, and consequently with the dementia, they may have communication issues. They have trouble with word finding or expressing themselves, but they may be having pain that they're expressing behaviorally through flailing or moving about in a certain way, or their blood pressure may be raised because of their pain. So I want to have the families be very sensitive to those issues, and to confer with their general practitioner to make sure that we have a good idea of what their pain issues are and their medical issues, and to make sure that their practitioners are really on it. And that can be done through Zoom or telemedicine. So those are some of the things I'm doing.
Right. So let's talk a little bit about how to console our children, how to console not only little kids, but also teenagers. This is, as we agree, this is a very unique time in the history. And there are many anxieties and fears and feelings of unsettledness, feelings that there's lack of clarity about the future. We don't know what the future has to bring. And this really reflects on how we behave and how we talk to each other and how we listen to the news and extract whatever we need from the news. How
I'm
is
sure
it?
it's a very confusing time for children.
Yes.
They don't have the cognitive capacity that adults or seniors might have, or haven't had life experience. So it's very surprising to them, I would imagine, Elizabeth.
Yeah.
So I think it's really important for parents to make sure that they feel grounded in the way they deal with their kids, that they have a positive and a hopeful attitude towards this. There's so much unknown that we can't even be pessimistic for our own sake. We know that the entire world is focused on this. We know that the entire medical and pharmaceutical world is focusing on this. And I think it's important for children and for teenagers to know this, that we focus our conversations on the hopefulness of the situation, that we're not in this alone. The fact, the phrase that I keep repeating to my friends and to those who call me, I say, you're not alone in this. We're all in this together. That is really a point of solace. It's a feeling of being a part of a big experience. And so let's talk about that with children. Liz, how do you deal with children when it comes to giving them these positive messages?
Great. Yes, that's a very important question. I think it's really important for parents to let go of their expectations for their kids right now, especially because it's such a confusing time and they may not understand a lot of what's going on. I definitely recommend not watching so much of the media, especially for younger children, because they may not be able to process what's going on or understand it, and they may feel more fearful also. So I think it's really beneficial for parents to have open dialogue, to be able to communicate with their kids, ask them how they're doing, especially if they notice that maybe they're feeling, they're acting out or they're looking like they're very sad. Asking them and saying, hey, how are you doing? Being able to communicate that, and also validating and supporting them at this time and letting them know it's okay to feel the way they do, because again, this is something that's new for everybody and we're all in this together. And so if parents are able to acknowledge that with their kids, it'll be a lot easier for them to tell them how they're feeling and how they're doing. And also if parents are feeling super stressed, of course, right now because of the extra childcare responsibility, even being able to communicate that with their kids as well and letting them know, okay, I'm feeling this too, we're in this together, and even modeling like ways of how to handle their own emotions too.
I mean, I'm even doing that with my adult friends where I'm saying, I'm here for you. And I know that this is hard, but we're going to get through it. And it means something to them.
Yeah.
People don't have the right vocabulary to address deep-seated fears or anxieties or apprehensions. And when a routine pattern is set for communicating, for example, one of my daughters does this with her children. Every day at dinner time, they go through the highs and lows. They say, okay, everyone, there are 4 of them in the family. So they say, okay, what were your highs today? And so each one gets a turn to talk about what was a good experience. And this, they used to do this before, but they have continued. And what were your lows? So these kids hear the vocabulary of adults, the fact that it's okay to express fears, okay to express negative feelings as well as positive. So it's not just all negative or all positive, but in the context of the same experience, you can find both. So how does that translate into the elderly, the ones that have memory impairment, the ones that have cognitive impairment? They may be feeling the stress of the situation, but may not have words. But if you put them in the context of conversing about these highs and lows, maybe they will open up. What is your experience, Dr. Jack, about that?
Well, I always make sure that I'm cognizant that I am working with a special population with the seniors, that they have special needs, just what you had just said. And I don't want to necessarily treat them like I might treat somebody of a different age, but they may be dealing with, again, dementia or special challenges. So they may have depression or anxiety, but they have trouble expressing it, almost in the same way that Elizabeth had mentioned, children express their anxiety and depression in a different way. The first thing I want to do is, if I'm working with a senior, I want to not approach them from behind. I want to approach them face to face, and also be very careful about my body language when I'm with them, because even though they may have memory issues, they're very sensitive to their surroundings, and they're sensitive to the way, to my body and to the tone of my voice. So I try to be very respectful. And then I also try to use the same words when I'm saying something. They may not get it the first time. So I'm very cognizant about repeating myself slowly, and so that puts them at ease. Right now they're in a different environment and they're getting used to maybe living in a different house. So I always want to make them feel relaxed. If they're having depression, it may be affecting them with their appetite or lack of activity. So I want to plan activities for seniors almost the way you might plan activities for children, getting them involved in house activities where they would have a responsibility and they can feel a sense of accomplishment. It might be folding laundry, it might be helping in making a meal, but those things can help with depression. And if they're feeling anxious, where they feel like something bad is going to happen, I try to help them express what they're anxious about and help them come up with their own solutions about how they can protect themselves or make themselves feel better or more relaxed with deep breathing or guided imagery. I also do things that involve their biographical memory. I like to talk about the times when they were married, when they got married, maybe where they went on their honeymoon or their high school or college experiences, and those things relax people when those things relax seniors when they're feeling anxious.
Yeah, those are really important. We keep talking and thinking in terms of who we have to take care of as adults. But then sometimes we forget that the middle generation, those who have the responsibility of caring for their children and teenagers, and sometimes the responsibility for caring for their aging parents or elderly parents. And also, this generation happens to have a great deal of discomfort about the financial situation now, their own issues. So how do they go about maintaining a balance in the middle of this big experience when they are charged with the responsibility of caring for not only themselves, but others?
I mean, they're what's called the sandwich generation. They're sandwiched in. They're right in the middle. Children on one end, and then their seniors are on the top end, and all that stress. And you mentioned the financial thing, that very, very hard. I'm glad that you're not forgetting about them. And
Dr. Liz, tell us a little bit about some of the things that adults should do in terms of nutrition, exercise, in terms of social connections that you want to highlight today.
I also want to note, going off of what we were talking about, people that have already had a lot of pressures even before this happened, people that were grieving, that may have lost a family member or coworker, or a friend, or people that have experienced a lot of stress may actually feel a lot more impacted by this because they're already going through so much before. So it's harder for them to cope with what's going on as well. Yeah, so what would be really helpful, I know for kids, doing the relaxation, doing meditations, taking deep breaths, finding activities to play together as well at home. I know kids are really creative, so just coming up with maybe like creating an art project together, or writing a poem, or writing a song. Having a place to channel all of these emotions is really important for kids, so that they can, feel like a little bit relieved about, all the stress that they're experiencing right now.
So I want us to now talk a little bit about the difference between physical distancing and social distancing. I think that these terms have been misused in the media, by the media. They have been passed on to people in a way that people are not clear as to what is the difference. Sometimes the social distancing is used instead of physical distancing. This virus is one that it's very contagious. When you're in the physical proximity of someone who is either a carrier or is sick with it, the chances that you get it are very high. To be able to maintain a stable situation with the healthcare system and make sure that the herd immunity is created without toppling, without destroying the healthcare service, we have been advised to maintain physical distance such that we are not in the position of contracting the virus. But this kind of remoteness from others, this kind of distance from our social settings and friends and relatives can be very devastating for some people and uncomfortable for our people. Regardless of whether you're an extrovert or an introvert, regardless of that, human beings are social animals. 95%, even more percentage of the people are social animals. We want to make sure that even if we're not interested in interacting very much with others, we want to know that if we want to interact, that is available to us. And during this time, I really want to make this clear that physical distancing, folks, physical distancing doesn't mean social distancing. It means that you can pick up the phone, call your friends, go on FaceTime, see someone. I know in many of the talks that we've had in the context of the association, people don't want to show their faces because, especially with women, they don't color their hair because of this situation, this and that and the other. But you know what? There is enough technology. The Zoom conferencing system that we're using right now is really a very special tool. So physical distancing does not equate with social distancing. You can still connect with people and know where they are and how they are and what they're doing, and let them know so that you are not feeling isolated and alone and lonely in this experience. And I think that's so important. It's important for everyone in the family, like, these Zoom birthday parties for kids. And Dr. Liz, I will ask you to address that. Or Dr. Jack, I'd like you to address these connections with the elderly.
Exactly. It's like what you said, Shakeh, and it's the old saying, people need people. We're biologically predisposed to want to be with people. And we have an uneasy feeling when we're left alone for too long. That's an evolutionary development. And so I try to always keep in mind that people want to be connected with others. Men, the research shows, don't necessarily always have to express their feelings, but they want to know that you're there. So with my guy friends or male relatives, I always just check in to say, hey, what's happening? What's going on? And that's it. They may not want to express themselves, their feelings and everything, but they need to know that you're there. And so that's a good thing. I always also try to keep in mind the concept of attunement and try to figure out what people may need. Certain friends or relatives may need different things, and I try to find out what they need and then try to meet that need, because everyone kind of needs a little something different. Some people need to be called a lot. Some people need to be asked how they feel. Other people may need to be offered things. Kind of just depends on the person.
Great. Yeah, that's very important. Dr.
Yeah, I want to say, that is really important. And knowing what everybody needs. I've actually seen people that have done birthday parties where they've driven by the person's house. They had cars lining up just to say hello, or have balloons. So everybody's really creative on providing support. I think that's the most important thing, is feeling like you have some support, having somebody to talk to, somebody that you could reach out to. I know, like you were saying, Zoom is a great one where you can have family dinners or take an exercise class. I know there's a lot of dance classes, and even participate in seeing family members or friends, or taking an art class. There's a lot of resources and ways of helping you stay connected.
Elizabeth, it sounds like you're recommending kind of thinking outside of the box, because that whole concept of driving by someone's house on their birthday, what an amazing feeling that would be for someone whose birthday it is, knowing that they're being acknowledged that way. You don't have to have the party, you don't have to have the cake in front of them, but they know that you're there and thinking of them. And even for me, I do an exercise class online through Zoom every morning, and the connection that I have with the members in the class, I feel like we're together, and it gives me that feeling that stays with me throughout the day.
So yeah, these are really great ideas, and we should really be learning from each other. Ideas that other people are implementing, they can be implemented by us as well. I would like to conclude this short talk by asking all of us to pay attention to those who are particularly impacted by this predicament. Those who had pre-existing chronic problems, whether they were mental health problems, emotional problems, or physical health problems. The media talks about, we hear on the media about the fact that those who have had chronic illnesses like diabetes or heart problems or blood pressure, etc., they are impacted very strongly by this experience. I would like us to highlight the fact that those who had emotional issues and psychological issues are also very heavily impacted by this. And this could be a trigger for the worsening of the conditions that they had, and they need to really pay attention to the the program that they were on, what is the right word, the regimen that they were on. If they had depression and they were on a particular med, this situation doesn't mean that they have to stop taking their meds. This means that they not only they have to continue their routine, but that they have to get in touch with their physicians, psychologists, psychiatrists, their GPs, their general practitioners, if there are issues that they're worried about. And also, we need to be very sensitive as a society to the needs of the poor and the less privileged who are home and who have no work, who have no income. We need to take that in consideration too, because this is a society. We are not insular beings. We are part of a fabric that is called society. So with that, with those my concluding words, I would like each of you to say a few words before we conclude this conversation. Dr. Liz, do you have something to say?
Yes, I wanted to also note, especially with children, it's really important to help them feel safe right now. Help them feel secure. And there's actually something called a transitional object, which is an object of comfort. So if your child has a teddy bear or a photograph, something that they can hold on to, if that helps them, feel better, or even that could be an opportunity to spend time with them and create something together, such as a photo frame or some other kind of object that they can feel more comfortable and safe. So I just want to reiterate that because I think it's really important.
So Liz, while you're on the topic, do you recommend that parents maintain their previously established routines rigidly, or is this a time that they can loosen their requirements, for example, for sleeping? If a child has nightmares and runs to their parents' bedroom, what is the reaction of the parent to that child? Do you have
Right. Yes, definitely not being so rigid right now, letting go of those expectations, because again, this is a confusing time and there's a lot of emotions going on. So it's really important to acknowledge that of your child and also be supportive. And it's understandable. I know everyone feels like they're a little bit out of control, and having that routine establishes some of the control, but it's good to be flexible because again, your child, is going through a lot.
So something occurred to me. I think it's very important for teenagers as well as children to feel like they have some sense of control over this. I think in the case of little kids, if they are taught how to, for example, wash their hands and not to touch their faces, and teenagers, if they're included in adult type conversations, if they're asked for their opinions, if they are asked to discuss this in the bigger frame of life and world, etc., that gives a sense of participation and control to the teenager too, I would imagine. And Dr. Jack, do you have parting words for us?
Sure. First of all, I like the fact that you're focusing and addressing our most vulnerable people in terms of children, in terms of the seniors, but you also were concerned about the adults in the middle. I'm glad about that. The research does show that with children and with people in general, if you have a sense of control in a situation, the trauma has less of an impact. And so I like that you're showing people how they can have control in a situation, and that can lessen the trauma. With my seniors, I always try to make sure that I'm addressing their needs, and they have problems expressing those things. I want to make sure that they're not dehydrated. I want to make sure that they're getting adequate nutrition, that if they're have a metabolic imbalance or something, constantly being involved and in contact with their doctors, and then making sure that they're not experiencing dizziness. So I'm constantly assessing, helping the family to monitor their physical responses, and then relaying that information to their primary care physician. And then, like what you said, helping them be, you had mentioned about the sense of control, helping them be involved in the environment in which they're living, preparing dinner, doing chores around the house, giving them assignments that they're going to like. That gives them a sense of accomplishment and control, like you had mentioned.
Thank you very much. This was a very very nice conversation. We have several different videos that we have done through the efforts of the Armenian American Mental Health Association. They are on our YouTube. The audience is more than welcome to go to those YouTube, to our YouTube channel, and to take out the YouTube presentations that may be of interest to them, because they're arranged there based on topic. I would also like to say that you will find several videos pertaining to domestic violence. This is a very, very tenuous situation for the family, and it brings together the members of the family in a very limited physical setting, and conflicts and arguments go up in numbers. But those families that have had history of domestic violence, they're particularly vulnerable to more violence, to the experience of more violence. Therefore, we have dealt with that issue in the context of several video conferences with people who work with that particular population. So with that, I would like to thank my two colleagues, Dr. Elizabeth Petrisca, as well as Dr. Jack Ayvazian. I am Dr. Shakeh Kaftarian with the Armenian American Mental Health Association. I would like to ask you all to stay well, stay safe. You're not alone. We're all in this together, and we'll come and meet you again in the context of our other programs. Thank you.